If you're a functional medicine provider, you probably are pretty aware that trust is a really important part of the process of getting patients to not only jump on board and work with you, but also to continue working with you over an extended period of time to relieve their current challenges. Unfortunately, a lot of functional medicine practices do not look at the referral process as part of the necessity for growing their practice until it's too late. If we're looking directly at functional medicine and you are getting most of your referrals from other partners and then all of a sudden they dry up, that doesn't happen on accident. And it usually doesn't happen over a conversation. It just happens over time because they feel either ignored, the people that they're referring to are not taken care of, and perhaps falling through the cracks, or even worse, the patients they're sending you aren't getting the care that you promised. Most functional medicine practices don't have any kind of referral tracking. They track a referral when they become a patient, but there's nothing happening prior to that. And I want to dive into today's episode and show you what typical functional medicine practices are leaving on the table by not identifying a practice specific to referrals. A lot of times you're humming along, singing a song, as my dad would say, when it comes to referrals. People are sending them in, they're coming in. A good portion of those people are becoming patients, but when the decline starts, it almost is invisible until it's not. And then the schedule is bare, and you have less referrals coming from the partners that you had established relationships with. All of those are part of referral leakage. So let's dive into what that's specifically costing functional medicine practices. If an average growing multi-provider functional medicine practice has an average of 25 new patients per week, and they lose 20 to 30% of those patients because of referral leakage, that's between 195 and 260 patients a year that you're losing. If we then multiply that by a very conservative number of $6,000 lifetime investment into your practice per patient, that's costing your practice over $1 million a year, almost close to $2 million in lifetime value annually. And so that's an annual number that keeps repeating. And if you have even more patients that you see because you have multiple providers, or you have significant costs associated with each patient above $6,000, I'll let you do the math yourself. The chances are pretty high. The number for that is even higher. And that is all money that is walking out the door because your referral process is either stagnant, missing, or maladjusted. Now, mind you, those aren't patients that said no. Those are patients that said yes to their primary care physician or whoever else you have for a referral partner. The initial yes was made. They said no after they ran into friction with your office, whether it be scheduling or not being able to get an appointment or not having their questions answered or feeling ignored. That is literally money flying out the door that you can put a stop on today. We haven't met yet. I'm Alisa Conner, and I help both professional services and specialty medical practices grow, not by outspending their competitors, but instead by creating patient and client experiences that your patients and clients can't wait to tell others about. So let's dive into why functional medicine referrals are a little bit different. Usually the trust between functional medicine doctors and their referral partners is very high until it's not. And so you may have a naturopath that sends you patients, or you may have a PCP who is forward thinking. You may work closely with integrative physicians, and they send you patients because they've only been able to go so far with the patients that they have. And so with trust, they send them your way. But if those patients are either not well received, or they're not communicated with effectively, or they fall through the cracks, those partners' trust in you is going to erode very quickly. And it doesn't erode loudly, it erodes silently in the shape of them not sending you referrals in the future. And that is detrimental to the growth of every functional medicine practice that is struggling with referral leakage. Too often, functional medicine practices treat their referral partners as transactional. You send me a patient, we take care of them, and we move on. And there's no give and take there. There's no follow up with the partners that you are utilizing. And so either the patient or the partner are left in the dark because there's no process in place to ensure that everyone's being communicated and, quite frankly, thanked for sending over new patients to the practice. I have found the providers that send patients your way are trusting you and trust that you're going to take care of their patient. But if that doesn't happen because there's no communication and no follow up, not only with the patient, but also with the practice that sent them to you. So, in actuality, you need a dual referral process that not only keeps the patient in the loop and make sure that they are being communicated with and served, for lack of a better term, effectively, but you also need an additional process that reaches out to the referral partner that sent the patient to you and keeps them in the loop. And even better, thanks them for their trust in you to be able to help that patient get to where they want to be in their healing journey. When you treat your partners transactionally and instead of as a partner, they feel like they're just there to send patients to you. If you believe in the power of energy, you know that with every action, it can cause an opposite reaction. And so if you are just utilizing your partners as a transaction to fill your practice, they feel it. And at what point do you think that is going to catch up with that reaction? And they're going to realize that they're not getting any benefit out of sending patients to you. And besides that, you're not treating their patients as well as you could. How quickly do you think they're going to cut off your pipeline? My guess is pretty quickly. In most functional medicine practices, they don't have anybody that takes full responsibility for referral partnerships and referral patients. They don't have a patient liaison that's specifically assigned to referral patients. And they more often than not, they don't have any tracking system for referrals. The only tracking that happens is when those people become patients. And so I want to encourage you to think about how you're treating referral patients before they become patients. And what's the process with not only the referral partners, but also the referral patients themselves. And in functional medicine specifically, there are a lot of things that need to be communicated because it's a different way to approach healing. And if those items aren't being communicated from the referral partner, patients may arrive at the front desk frazzled, confused, unsure of what it looks like to work with a functional medicine physician, and the front desk gets bombarded with all of that on top of their regular duties. And if you don't have a capable person that is well trained or able to answer those questions effectively, that patient's walking out the door before they ever get back to talk to the physician. And a lot of that can be avoided by setting clear expectations, not only with the patient before they arrive, which would require a process, but also with your referring partners so that they have the tools and assets available that they need to help their patient understand what it looks like to work with a functional physician. If they don't have that, they're just going to fly with it and hope that send you the right people. Average people don't have the time to understand everything outside of their regular sphere of work. And so I would say that is exasperated in the healthcare world because there is so much to know. And so those partners that you've shared information with, if you don't keep it quick, timely, and easy to understand so that they can share it with patients and get them really clear on why they're going to a functional medicine practice to begin with, there's going to be a struggle to even getting those people in the door. And we're not even talking about the people that never make it to your front door. At the end of the day, your practice administrator or practice manager is likely the person that has to pick up the pieces and do some relationship repair, not only with potential patients that may have had a poor first experience, but also with your referral partners, because now they're disappointed that their patient isn't going to move forward with you for whatever reason they encountered when coming to your practice for the first visit. They are forced to smooth over misunderstandings and more effectively communicate and try to win back those relationships. That puts them in a very unfair position. And not only that, but these are all things that they have to take on outside of their normal role and responsibilities. So when they are forced to deal with these disruptions and these challenges, they eat up a lot of their time because you have to have those conversations in order to rebuild the trust in the relationship, leaving their typical job requirements by the wayside until they can get to them later, putting them even further behind, causing overwhelm, stress, and at the end of the day, putting your practice at risk for losing a really great team member. The other component that is a little bit different for functional medicine when it comes to referrals is that most patients are physician to physician. So if you have a physician in your practice who decides to leave or go out on their own or retire, all of his patients are going with him unless he turns them over to your practice. If they're going off to start their own practice or they're moving to another practice, they're not leaving their patients behind. And those patients have signed up with that physician. And so the likelihood that they're going to just want to be shifted over to someone else is very slim. The practice administrator or practice manager doesn't have any visibility into where patients are with that physician and whether or not there's a way to keep them within the practice. I just had this very same experience with my acupuncturist. She is leaving the practice that she's been with for a really long time, and she's going out on her own. There's not a non-compete clause between her and the current practice that she's in. And so the good majority of her patients are going with Dr. Jackie. And that is going to monumentally affect the practice that she was just at because, and there's another fold to this, with the owner of that practice who pushed most of the patient load over to Dr. Jackie because she had a newborn baby. Well, that baby's now almost 2, but the owner hasn't done anything to rebuild the practice for herself. So my guess is that when that practice loses all of the patients that have been working with Dr. Jackie and are satisfied, it's going to be really hard to rebuild that patient load. And also, I think that the owner has hurt her reputation a little bit because when people would come to see her, she automatically shifted them to Dr. Jackie because she didn't want to work the extensive hours. And so now, as a patient, you feel a little bit slighted by the reason you went there. The likelihood that I will go back as a patient, for example, is very slim because the minute that I worked with the other practitioner, she sent me to Dr. Jackie saying, that she wasn't taking on extra patients. When you treat patients that way as though they're expendable, that's exactly how they feel. And so the same can be true with your functional medicine doctors. If they have in some way slighted patients because, they've shifted them to a different physician for whatever reason, the likelihood that if that physician leaves, that they're going to stick with the practice or come to one of the other doctors in the practice is slim to none. And so you want to gain visibility to where those patients are, see who they're seeing, see who's active, see who's not active, so that you can keep tabs on those patients if and when those physicians decide to retire, go to another practice, or start out on their own so that you can salvage some of those relationships if need be. So let's take a look at the financial numbers for specialty medicine as a whole, and then dive directly into functional medicine when it comes to the loss that referral leakage can lead to. So if we are looking just at medicine as a whole, you have 3 referral patients that you lose because of any number of reasons, and they don't convert. If each of those patients is worth $6,000, that's a total of $18,000 a week. If we multiply that by 52 weeks in the year, that's close to $1 million a year. And that is a very conservative number, not only for the number of loss of patients, but because of referral challenges, but also the lifetime investment of those patients, especially for functional medicine. $6,000 is a very conservative estimate per patient. If we are going to look at functional medicine as a whole, the number of patients on average that a growing multi-physician practice would see is 20 to 30 new patients a week for an average of around 1,300 patients. If you lose just 20% because of referral leakage, which is a very conservative number, I'll talk about that in a minute, you are leaving behind 260 patients per year. Now let's talk about what I mean by conservative number. I recently read a study that stated that in healthcare in general, referral leakage causes a leakage between 30 and 52%. And you can fall anywhere in between there. So when I say 20% is a very conservative number, it's actually on the low end, and chances are pretty high your practice if you are not doing something proactively to avoid referrals leaking through the cracks, are going to be at the higher percentage rate, whether that's 30%, 40%. You would have to do the math yourself and see how many referrals you get versus how many people that actually book appointments and show up and become patients. I highly recommend that you do that because that is going to give you a very good grasp of where you're losing patients and how much it's costing your individual practice. But if we are using those conservative numbers and we're looking at 260 patients that never make it either in the door or schedule or become a patient, and we multiply that times the very conservative number of $6,000 a patient, that lifetime value for those patients is just over $1.5 million a year per year. And so if your practice can afford to lose $1.5 million a year, more power to you. But most organizations, practices, and businesses cannot afford to have that big of a gap in their recurring revenue. And mind you, this isn't revenue that you are spending money on to attract new leads. This is revenue that was already somewhat guaranteed because those were patients that were referred to your practice by someone that they already trust. And because they weren't treated well, effectively, quickly enough, or communicated with, they walked out the door and worked with someone else. And so it literally is money walking out the door that you have very much the power and the ability to stop if you have the right process in place. If we look at your referral partners and they go silent because their patients are either not being taken care of or they're not being communicated with, or for whatever reason, they stop sending you referrals. And we look at if they're just sending you one patient a week or a month, you can't just look at that as losing one patient because you're actually losing all of the patients they would have sent you over the next 12 to 24 months. And you have to calculate the loss on that cumulative number to determine, where you need to plug these leaks. If you have a referring provider, if they were sending you 2 patients per month and they go silent, that's 24 patients a year. You have those 2 patients per month walking out the door, and that's just one referral relationship. Each referring partner that goes silent, if they only stop referring one patient, you may think, that's just one patient. But over time, if we calculate what that impact means is that if they were sending you one patient a month, that's 12 to 24 patients over the next 2 years. And that's only if they send one patient. Now, if we look at referral partners that send you multiple patients, like 2 to 4 patients, that totally changes the game and amplifies the amount of money that your practice is losing. So if you have just say another referral partner that normally sends you 2 patients a month, over 12 months, that's 24 patients they're no longer sending your way. If the average patient is $6,000 on the low end of investment, that is around $144,000 per silent referral partner that you're losing out on. In reality, you probably have somewhere between 5 and 15 referral partners for your practice. If you lose even 2 or 3 of those partners silently because they back away and they just stop sending you patients, you can see that the financial attrition to that loss could be monumental to your practice. If we were to use the example of an orthopedic practice, the investment of their patient is usually, a flat average cost of $6,000 per surgery. That's it. But when you're looking at functional medicine, the cost per patient expands over time. And the longer that a patient is with you, the higher that investment into your practice is, including things like the initial investment, and then you have ongoing labs, and you may have supplements that you recommend or programs that you send them through to amplify the investment that they are spending with your practice. So the long-term investment for your patient is way more important than the initial investment of that patient walking in the door, which is why it's really important to have a process in place that also nurtures that patient along the way and make sure that they are being taken care of. But if you lose a patient either before they walk in the door or from that first visit, you don't even have the opportunity for the amplification of that revenue because that patient's never coming back. And so thinking about that referral process from the patient perspective as well as the referral partner perspective is really critical to your practice growth and to the positive effects that patients are going to experience by working with you over time, which affects your long-term reputation. So this little bit of math that we did is probably bringing to light a few questions that you're starting to wonder about your own practice. And it would be really good of you to think about some of these questions moving forward so that you can calculate where you're losing referrals or where you're losing referral partners. And one of the biggest questions is how many partners do you have right now who are sending you ongoing patients? If you have 5 to 15 referral partners, but all of your referrals are coming from 2 or 3 people, you have 13, 12 or 13 partners that are basically silent. So what would happen if you re-nurtured those relationships or sought them out and found out if something went wrong so that you could repair the relationship and get them sending you referrals again? The other question goes right along with that is if they've only sent you one referral in the last year, what would happen if they sent you multiple referrals, or why aren't they sending you multiple referrals? This is an important question to not only involve your team in, but also to reach out to those referral partners and ask the similar question. Hey, we noticed you've only sent us one referral this year. Is there a reason behind that? Is there something we could do better? The third question you can ask yourself and your practice is, how many referrals came from your partner 6 months ago? And have they sent you referrals since? And if not, why? And some of this may be that, they don't have the patients to send you, but some of it may be that there's a little bit of a challenge in your referral process. And if you can't answer these questions, then you have a systems gap and you need to plug that gap before it costs you any more revenue, patients, or reputation points. So let's dive into a few things that are not the problem. This is not a marketing problem because this doesn't focus on lead generation or advertising or getting new people to notice who you are and what you do. This is a problem that exists with people who already know very well what you do and are sending potential patients your way, and they're still not becoming patients. This is also not a physician problem. You may have the most qualified, best physicians in your practice, but if the referrals never get to them and they never book an appointment, they can't ever have that experience with that physician. The individual relationship skills of the physicians is great, but it's also not scalable beyond that physician. So if that physician leaves for whatever reason, whether they want to retire or start their own practice or go somewhere else, you are essentially losing out on all of your patients. And so how are you managing that loss? And how can you ensure that that physician stays where they are and are happy, and or that you have access to their patient load so that you can give them an option to stay with your practice if that physician leaves for whatever reason? What this is a trust infrastructure problem. More often than not, practices don't have a process or methodology or framework in place to track and nurture referrals. And when that doesn't exist, referrals fall through the cracks. Now, I'm not saying you're going to convert every single referral that you receive into a patient, but if you're losing even half of the people that are coming through the door, you have a significant challenge that needs to be addressed. Where growth happens in your practice is not determined by whether a patient comes to you on their own or through a referral partner. Where growth happens is in what happens next. Are they well taken care of? Are they communicated with effectively? Do they have their questions answered? Are they addressed or reached out to in a quick and professional way? And are they left with more confusion than they started with? Because if the answer to those questions isn't to the benefit or clearing confusion for the patient, you are going to lose them to someone else. One of my favorite sayings that I learned when I was learning how to do copywriting work was, if you confuse, you lose. And that cannot be more true in medicine, because there are a lot of things that go on in the medical world that medical organizations take for granted that people understand, and they speak very often in medical terms that average people aren't familiar with or don't understand. And so if you're not speaking a language that your potential patients understand, know what that means, or relates to their specific problem, They're going to find someone that talks to them in a way that they do understand and doesn't make them feel like they have to go get a PhD or an MD to keep up with you or understand what you're telling them they need to do. When you're looking at what happens next with a patient, if that's not communicated not only to the referring doctor, but to the patient, you may lose people along the way and they may not either book or they may cancel their appointment or just no show because they don't understand what it looks like to move forward or how it's going to benefit them long term. And one step further is those referral partners likely refer patients to all different types of colleagues and all different types of practices. My best guess is that they rarely receive any kind of recognition for those referrals. If you can be the practice that reaches out in a way that is unique and special, whether that's a handwritten note or a specific email that lets them know that their patient is taken care of and how grateful you are for that referral, they're going to remember you. And that's not only going to catapult the number of referrals that they send your way, they're going to start talking to their other colleagues about the way they were treated by you. The opposite case is also true, unfortunately. If they weren't treated well, they're going to share that information as well. So it really is to your best benefit to adapt some of these very unclinical decisions and instead start to bring a little bit of hospitality into your practice. Not only is it going to differentiate you from everyone else out there, but it's going to make people feel like they matter to you and that you care. The 3 places in your process that you can amplify and modify quickly that will show not only your patients but your referral partners that they matter to you are as follows. 1, send a confirmation to the referring partner that lets them know that their patient arrived, that they were seen, and that they are being well taken care of. Whether that's an email, and it can be a templated email, it doesn't have to be anything fancy, but let them know, close the loop on that communication so that they don't feel like they're just sending referrals your way and that nothing is happening. 2, ensure that prior to the patient arriving and that when the patient arrives, that they are clear about why they're there and how functional medicine works and why it's different than their regular primary care or other specialists that they're working with, and go over what it's going to look like for their first appointment. This ensures that their first visit is less confusing, the expectations are set, and that they're more than likely going to move forward because they already know where the appointment is going. And then the third thing you can do is ensure that you close the loop on the communication after the visit with the referring partner. And that's as simple as saying, hey, I met with Jane Doe today. We walked through the challenges that you had already mentioned, and this is the treatment plan that we're going to move forward with. I just wanted to ensure that you are kept in the loop so that you can put it in her file or you can keep tabs on this as well. So the next time that she comes into your office, you'll know where we are and how we're working with them with Jane so that you know how to proceed on your end as well for whatever you're working with her on. This not only acknowledges that they sent you a patient, but it also confirms that you have their patient's best interest at heart and that you are proactively taking care of their patient and that you're also grateful that they sent the patient to you. If you tune into these episodes regularly, you know that I always like to give you an action plan. And we walked through a little bit of the action plan earlier. So if you didn't catch that, go back and listen to what the things are that you can do to proactively start fixing your referral problem. This is in addition to that. Step number 1, review your referral process and see where it's breaking down from the patient standpoint. Are people falling through the cracks because they aren't being communicated with prior to their appointment? Are they never making the appointment? Are they no showing for appointments? And just write down where people are getting lost along the journey and document if you have a process in place, where the process is getting broken. And if you don't have a process in place, where you need to create one. The second step of your action plan is to do the exact same thing with your referral partners and determine what is that process? What does it look like? And where are you silently losing referrals from your partners? And who? Documenting who isn't sending you referrals anymore is really important because that could be for any number of reasons. And it most definitely requires you reaching out to those referral partners to find out what the heck is going on. And then the third step of your action plan is to choose one of those two processes and make just one change this week. What one thing can you change within the process or by creating a process that will make a difference in your practice this week? Implement that one change. You don't have to do everything right now. Not everything has to be fixed immediately. Things can be fixed over time, especially if the processes don't exist. Most of these changes aren't monumental, but they will definitely start to shift the tide of the ship to make sure that it's going in the right direction. If you've made it this far in the episode, you likely know you have a referral leakage problem, and you're a little bit concerned by the numbers that we talked about in this episode. This is the exact reason I created the Referral Recovery Lab, which opens on June 4th for the very first time. This roundtable experience is being built specifically for practice administrators and practice managers who want to solve the referral leakage problem. There's only going to be 20 spaces available, and that's on purpose and very intentional. I want to have the capacity and the time that I can dedicate to every person in the group to ensure that we actually make traction in solving this problem. And we're not just learning a bunch of new concepts or ideas. We're actually able to apply them so that you can see your referrals grow. Because this is an active group and not a training and not an online course or random webinar, it's critical that every person in the group participate and be engaged in the group, because the peer-to-peer growth that's going to happen in this group, I'm most excited about. Whether you are in a room with all of the same specialty practice or not, chances are pretty high that you won't be. You will take away valuable relationships, valuable insights, and camaraderie around the same challenges that you probably aren't finding anywhere else in the industry. The program isn't open yet, but the waitlist is. And as a waitlist member, you're going to get early access to when the program does open. Now, if the 20 spots fill with people that are on the waitlist, it's full. I'm only taking 20. And I fully expect that this program not only will be full, but that there will probably be emails sent begging to get in. And I am holding a firm boundary of just 20 people. The program will be launched again later, but this founding member cohort has a twofold benefit. The first is that the founding members get the opportunity to help flush out and create how this program is going to move forward for other people, and get to have the hands-on experience of ensuring that everything they want within it is added. And there are probably things that I haven't even thought of to add into the program. And I'm excited to have access to the brains of 20 other people to help me put into perspective and into the program exactly what is needed to solve this referral challenge. And the second benefit of signing up for the founding membership is that this is the lowest price it's ever going to be offered. So once those 20 spots are filled, they're full. And then when it launches again, it's going to be at a new price, and it may look a little different when it's rolled out. So if you are interested in being part of this exciting new opportunity and finally solving that referral leakage challenge, I invite you to sign up with the link below to get on the waitlist. The program is slated to open June 4th-ish, and chances are pretty high that if you are on the wait list, you might get a little sneak peek of when that program opens. You may be on the fence and think, I don't really need to solve this referral problem, do I? But I want you to ask yourself, what does your practice, growth, and your personal experience look like if you keep doing things the way you're doing them now? In 3 months, 6 months, is your practice going to continue to grow, or is it creating a downhill slide? And where's your sanity going to be if you keep going the way you're going? If you answered, I don't want to do this anymore, help, your answer is to go sign up for the wait list. You can, again, do that with the link below or at alisaconner.com/lab. I look forward to seeing each and every one of you inside. In the meantime, thanks so much for hanging out with me this week. And if you've enjoyed this episode, I would love for you to share it with somebody else who would find value in it. If you're over on YouTube, hit the like button. YouTube loves that, and so do I. And I will see you next week. Take care, be well, stay safe. See you soon.